started hanging out with my youngest daughter's father. Me and Nina's dad were kind of an item. It was kind of a rocky relationship, you know. In 1993, I decided that I wanted to have a child. So I planned it out, even down to when I was going to be fertile and where I wanted to conceive the child. And got pregnant by him. Of course, I wasn't drinking and I wasn't doing any drugs, and that sucked. During the second half of my pregnancy, I developed a lactose intolerance. Anytime I'd eat cheese or drink milk, I'd throw up, and I was having to get my vitamin C elsewhere, which really sucked. I went to labor. I was in labor for a week, and it wouldn't get hard. So I went into my doctor, and they finally decided, okay, we're gonna induce you. They sent me over to the hospital. So I had basically gotten up that morning, not eaten anything, gone to the doctor. They went and admitted me in the hospital, wouldn't feed me, broke my water, made me walk up and down the halls. I mean, I walked up and down those damn halls for hours. Wasn't doing a damn thing. So about 11 o'clock that night, no, I guess it was more like 10, I start threatening the nurses that if somebody doesn't bring me some food, I'm going to kill somebody, or I'm going to go downstairs to the vending machines. So they bring me a tray with cream of asparagus soup, and I'm like, I told you I can't have milk. It's going to make me throw up. Well, that's all they had. Well, gee, no kidding. It's 10 o'clock at night. So I ate the Jell-O and drank the broth, and that was about it. And then I started threatening them some more, and they're going, well, you can't leave the floor. That would be against medical advice. And I said, I can do anything I damn well please. So they call my doctor at home, and they get the okay to go ahead and give me Pitocin, which of course this took a while for them to organize it. Now, I hadn't eaten anything really in more than 24 hours at this point. My veins were rolling and collapsing. They decided they wanted to put the IV in the back of my hand because they had so many other damn monitors hooked up to my arm and around my stomach, and I mean, it was insane. The backs of my hands were black and blue by the time they were done. I was crying. They ended up having to put it in my wrist because they couldn't get a vein anywhere else. That was actually worse than actually giving birth. So, by this time, I don't know, it's like 1 o'clock in the morning. We try and get a little bit of sleep. And about 2:30, I wake up, and I start hitting the call button, you know, because I needed to go to the bathroom, and I'm hooked up to all this shit. I couldn't move, you know. So the nurse finally comes down, and I go to the bathroom and all that. And while I'm in there sitting on the toilet, I threw up a little bit, and I knew it was time. And they took me into delivery, and they kept saying, no, don't push, and you know, you're not dilated enough yet. And I'm going, no, it's time, check me. And they checked, and yeah, I was dilated enough, which of course meant it was too late for them to give me any drugs. So I had natural childbirth with both of my children, by the way, which I would much rather do again than pass a kidney stone, for the record. Because passing a kidney stone, that shit is brutal. But anyway, so they got me in the delivery room. There wasn't even anybody next to the bed when I pushed her out. And she was a beautiful baby. Beautiful. It was a great moment.